What is up, guys? Following this announcement,
we will stop overseas care workers from bringing family dependents.
a lot of nurses have been concerned. Are they going to be able to bring their dependents over to UK? Does it also apply to nurses and doctors as well? Since most think that nurses and doctors are also classified as care workers. So in this video, I'm going to be filling you on the details on whether nurses can still bring their dependents over to UK or not. Then there's the issue of the salary threshold being raised to 38,700. What does that mean for people who are already in the UK and will need to renew their visas, for example, after 2 years or after 3 years? For one to be able to renew the visa for their dependents, they need to be earning a salary of 38,700. So does this mean they are going to be deported? You will find out more in the video. So guys, let's get into it.
No comparison. I'm a savage, yeah. Classy, bougie, ratchet, yeah. Sassy, moody, nasty, yeah. Acting stupid, what's happening? What's happening? I'm a savage.
First of all, guys, overseas nurses and doctors are the backbone of NHS, and without them, the NHS would collapse. If you look at the statistics, as of June 2023, 264,822 NHS staff reported a non-British nationality, accounting for 18.7% of all staff. In addition, 35% of the doctors who work in the NHS are from overseas. This becomes very clear that the UK NHS is dependent on staff coming from overseas. And this statistics only covers England, guys. We also have Northern Ireland, Scotland, Wales. There are so many overseas nurses and doctors who work in those areas. So if you are coming from overseas and you are in UK and you are working in the healthcare sector, know that you are very, very important and you are essential, because without us, the UK will definitely collapse. As for care homes, many of the care homes wouldn't be here without foreign workers. As an individual who works in care homes, I can attest, because there have been situations whereby, for example, there's 20 staff members during the day, and out of the 20, 18 are from overseas and only 2 are local. This goes to show that overseas nurses and doctors are essential. Even if it's overseas care assistants, they are all essential. Whether you're a care assistant or you're a support worker, we are essential. That's why they are hiring from overseas, because if we're not essential, they're not going to hire us from overseas. So now they've said care workers can no longer bring their dependents. So does it mean that doctors and nurses cannot bring their dependents from overseas? If such a law is to be implemented, it will mean the NHS is going to collapse. So such a law has not been implemented, guys. No nurse or doctor or care assistant would like to relocate to UK to come and render their services to the United Kingdom but not be with their families. Family is very, very important, guys, and it is not fair for the UK to say people should not bring their dependents to UK. At the present moment, they only said care assistants cannot bring their dependents to UK. When they say care workers, here in UK, care workers refers to healthcare assistants, support workers, domiciliary carers, live-in carers, and senior care assistants, for example. So nurses and doctors are not categorized as care workers. Nurses are categorized as nurses and doctors are categorized as doctors, and these professionals all fall under the health and social care, but they are not classified as care workers. So this new rule that has been put in place does not affect nurses or doctors. So this law only applies to care assistants, guys, or care workers. The people that I've mentioned, like the senior carers, the support workers, domiciliary carers, they are the ones who cannot bring their dependents from overseas, because even when they talked of the statistics, they mentioned the number of people who were brought in by carers and senior carers from overseas, which was 120,000 people. There is no mention of the number of dependents who were brought in by nurses or any mention of the number of dependents who were brought in by doctors. So nurses and doctors are not affected in this regard. So it's only the care workers who are not going to be able to bring their dependents from overseas. So guys, there's the issue of visa renewal. For you to be eligible for UK indefinite leave to remain, you need to be in UK for at least 5 years. So if you are given a visa for 1 year or for 2 years, you'd need to renew that visa for 3 more years if it's 2 years. And if it's 3 years, you need to renew that visa for 2 more years. However, if you are renewing a visa, you have to meet the eligibility criteria. And you have to earn a salary where you're going to be able to take care of your family. And the new salary will be standing at 38,700 if this law is passed. Even the British are complaining that they might not be able to live with their family, as this law is discriminatory and anti-family. So, which means if you're not earning £38,700, you are not able to be united with your family. And there's a likelihood that if your spouse is not earning £38,700, when it's time to have your visa renewed, there's a likelihood that the family can be denied and the family can be deported to go back to their country because they do not meet the eligibility criteria. So simple put, for your family to remain together with you in UK, you have to have a salary income of £38,700. They state that if you are not exempt from the minimum income requirement, the immigration rules say that if you cannot meet the financial requirement from the sources approved in the rules, but you have other sources of money to meet the requirement, then your application can still succeed if refusal could result in unjustifiable harsh consequences for you, your partner, or a relevant child. A relevant child is a child under the age of 18 who it is evident will be affected by a refusal decision. If you cannot meet the income requirement at all, then the application can only succeed if refusal would result in unjustifiable harsh consequences. So if you are to renew your visa, you have to be mindful of what has been stated there, guys. So which means you have to have other sources of money where you're going to be able to prove that you're going to be able to take care of your family, because without those sources of money, the visa renewal can be denied. And like they've already said, if you don't meet the salary requirement at all, then the application can only succeed if result would result in unjustifiable harsh consequences. And guys, it's for the Home Office to state whether it's unjustifiable harsh consequence or not. So if Home Office does not think that this is an unjustifiable harsh consequences, the visa will be denied. So be mindful of that. So this is all that I wanted to share with you guys. Take note, nurses can bring their dependents to UK. They're not affected by this new law. And guys, do let me know what you think of this in the comment section. And thank you so much for watching. I will see you in my next video. Bye.